I'm Krista Mayamnako from BSN 11-3 of Group 27, and for today, I will perform the oral administration of medication return demonstration. Oral administration is the most common, least expensive, and most convenient route of administration for the patient. In doing so, it is important to remember and adhere to the 10 rights of medication administration. So the 10 rights of medication administration includes the right patient, right medication, right dosage, right time, right route, right client education, right documentation, right to refuse, right assessment, and lastly, right evaluation. In preparation, check first the doctor's order. Prior to the procedure, the first thing to do is to check the physician's order. Check the physician's order to know what medication should be given to the assigned patient. Second is to know the reason why the patient is receiving the medication. So this time, the patient needs to take the vitamin C for the wound healing. It is needed for many functions in the body, including helping the body to use carbohydrates, fats, and proteins. Vitamin C also strengthens the blood vessel walls. Check is to check the medication administration record, or the MAR, of course with the physician's order. And next is to verify the client's ability to take the medication orally. So if the patient can swallow, is NPO, is nauseated or vomiting, has gastric functions, diminished or absent bowel sounds. Next thing is to do the hand washing. So this is to deter the spread of the microorganisms. This time, I will now prepare the necessary supplies and bring the requisites in the preparation area. So the requisites are the medicine cup, the medicine tray, and if needed, the stethoscope and the sphygmomanometer. This time, prepare the medication for one patient at a time. Obtain the correct drug and compare the name of the medication and the label with EMAR, or the medication ticket, and accept with ADS after removing the jab. Read the MAR and take the appropriate medicine. Now, compare the label of medication on the order in the MAR. Now, recheck the label of the medication with the MAR and note for the expiration date. This time, place package unit dose capsules or tablets directly into the medicine cup. Do not remove the medication from the package until the bedside. If using a stock container, pour the required number into the bottle cap and then transfer for the medication to the disposable cup without touching the tablets. Break only the scored tablets if necessary to obtain the correct dosage. Use a cutting or spitting device if needed. If the client has difficulty swallowing, check if the medication can be crushed. If it's acceptable, crush the tablets to a fine powder with a peel crusher. Place the prepared medication and MAR together in the medication cart. So assuming that I already put it on the medication cart because there is no available here in the house. Now recheck the label on the container before returning the bottle, box, or envelope to its storage place. It is important to remember to avoid leaving prepared medication unattended, as well as to lock the medication cart before entering the client's room. I have already done preparing the medication, the MAR, and assuming that I have put it on the medication card. This time, I'm going to check the room number against the MAR before entering the client's room. And afterwards, I'm going to close the door to provide the client's privacy. Good day, dear. How are you?
I'm fine.
I am Krista Mayamnako, your student nurse for today. And for the verification, may I have your complete name
Anya Elmon.
and your birthday?
February 17, 2011.
Okay, great. So this time, discuss the purpose of the medication. So dear, your doctor Dalisay has prescribed you the vitamin C, and its generic name is ascorbic acid, which means you have to take it once a day after your meal, and it is in the tablet form. It is in the tablet form, which means you have to take it orally. Okay? Very nice. So, vitamin C is necessary for wound healing. It is needed for many functions in the body, including helping the body to use the carbohydrates, fats, and proteins. Vitamin C also strengthens the blood vessel walls. If taken too much, it has many side effects such as nausea, vomiting, headache, and insomnia. So dear, are you sitting now? Are you fine taking the medicine in that position?
Yeah.
Okay, nice. So, if needed, perform the pre-administration assessment, which is the pulse rate, the respiration rate, and the blood pressure. So dear, before I will give you the medicine, I will first check your pulse rate, your respiration rate, and your blood pressure, okay? Nice. May I have your hand? Now, compares name of medication and labels with medication tickets at client's bedside. If using the EMAR, scan the client's barcode to verify the medication and compare the labels with barcode on the JAG and EMAR. Administer the medication and the correct time, takes the medication to the client within the guidelines of the agency. Okay? So, dear, I will give your vitamin C now since you are done taking your breakfast. Give the client sufficient water or prefer juice to swallow the medication. the client is unable to hold the cup, use the pill cup to introduce the medication into the client's mouth and give only one tablet or capsule at a time. And if an older child or adult has difficulty swallowing, ask the client to place the medication in the back of the tongue before taking the water. And if the medication has an objectionable taste, ask the client to suck a few chips beforehand, or ice chips beforehand rather, or give the medication with juice, applesauce, or pudding if there are no contraindications. And if the client says that the medication you're about to give is different from what the client has been receiving, do not give the medication without first checking the original order. Stays with the client until all the medications have been swallowed. Okay, dear? So, very good. You are done taking your medicine. I will leave you for a few minutes so that you can rest. Do you need anything? Okay, great. I just want to thank you for your cooperation for today. Okay, so have a good rest. Thank you. This time, document each medication given. Now that I'm done with administering the medication to my patient, I will proceed to the documentation process of the procedure I have just done. The documentation will include the medication route type and time it was given. So I have given my patient vitamin C as per the doctor's order. The vitamin's generic name is ascorbic acid to be taken once a day after a meal. Now also include the documentation of any complaint from the patient. And if the medication has been refused or omitted, then also document the reason for omission. Lastly, always remember to affix your signature on the documentation sheet indicating that you have carried out the doctor's order. After that, dispose all supplies appropriately and replenish a stack and return the card to the appropriate place and discard used disposable supplies. Thank you for watching.